This is Greg Reybold, and you're listening to the PBM Reform Podcast.
You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the PBM Reform Podcast, where we dive deep into the world of pharmaceutical benefit management, cutting through the noise to uncover the truth. Since 2019, we've been your go-to source for the latest on how PBMs impact patient care, drug pricing, and the very future of pharmacy. Here, we champion the role of pharmacists, the most knowledgeable advocates for medication safety and expertise. Join us as we expose and generate discussions that are reshaping healthcare and explore how we build a better payment system which focuses on advancing pharmacy care.
Hey, what a special episode of the PBM Reform Podcast. I am proud to introduce our new host, Greg Reybold with APCI. Greg, we've been working on this relaunch of the PBM Reform Podcast for quite some time.
Yes.
I'm so excited to have you here. So take it away, Greg.
Yeah, thank you so much. Appreciate it. Really excited to be here. Obviously, big fan of Pharmacy Podcast Network and Todd's work for a long time. And so, had the sort of opportunity to be a guest from time to time, and really excited to host, and could not be more excited. So our first guest is Emma Freer with American Economic Liberties Project. And look, it's 2025. It has been a massive year for PBM reform at the state level. I would say the last 2 to 3 years at the federal level, certainly 2024 and moving into 2025, we're seeing all sorts of interesting things. And, excited to talk to Emma because American Economic Liberties Project is frankly doing some of the most interesting, smartest, and aggressive work in the PBM space. And importantly, so much of what we do in pharmacy is unfortunately talking to echo chambers sometimes, right? Sometimes we're talking to ourselves, we're hearing from ourselves, we're hearing from pharmacists and people who work exclusively in pharmacy. And American Economic Liberties Project presents a very, very different point of view in that regard. And so I think it's so important to hear, A, some of the smartest voices in the space, and B, also from time to time, folks who are not necessarily pharmacists themselves or representing pharmacy. And so, Emma, thank you so much for joining, and couldn't be more excited to have you as sort of our first guest for the podcast relaunch. Maybe little background about yourself and American Economic Liberties.
Yeah, well, thank you so much for having me. It's a real honor to be the first guest on the relaunch and a non-pharmacist guest. But I've learned so much working with pharmacists, and I really appreciate their expertise. A little bit about me and Economic Liberties. I am a senior policy analyst for healthcare at AELP. And Economic Liberties, or AELP, was founded in 2020. It's a non-partisan, nonprofit research and advocacy organization, and it's really focused on understanding and solving the problem of concentrated economic power in the United States. And you kind of alluded to this, this is a problem across industries. We aren't only focused in the healthcare space, but as a healthcare policy analyst, I'm biased, and I think that this problem of concentrated economic power is, perhaps the most dangerous and fatal in the healthcare space, and really deserves our attention. So that's a little bit about our organization and what we do.
Yeah, and what I would say is I love that point you just made, right? Because obviously, consolidated power, vertical integration, anti-competitive conduct is a problem across industries. Like there's no doubt about it, right? And there's important implications, whether it's in social media, but when you're talking about healthcare, you're talking about people's lives potentially. And from my perspective, it just so happens that when you're talking about vertical integration and PBMs and health insurance companies in particular, they're amongst the biggest companies in the world, right? Like this is the massive market share.
Yeah, I think that's something that people don't always realize. We recently launched this initiative called Break Up Big Medicine that is kind of a home for healthcare work. And, when we talk about big medicine, we're talking about these vertically integrated healthcare conglomerates. And like an interesting fact, it's a horrifying fact, but in 2000, there were no big healthcare conglomerates on the Fortune 20. And today there's 7. And so you can see how much bigger and financialized these companies have become and how powerful they are, in the economy and the business landscape. And they're making money off of people's inability to access quality healthcare. So yeah, I think it's a huge problem and getting more extreme every year.
Yeah, absolutely. And I want to jump into, I think to start out, some of the action from the administration, the second term and also first term. But before that, could you share just a little bit, like you have a pretty good team behind you, right? Like you got some economists, some folks with pharmacy perspective, like a lot of different, like just a little bit maybe about the team that makes up American Economic Liberties.
Yeah, we are growing recently, so our team is getting a little bit bigger in the last few weeks, even. But we have an excellent senior fellow who's a pharmacist named Benjamin Jolly, who I have since learned is like a celebrity among pharmacists.
Yes, he is. He does awesome work. Yeah.
Yeah, we have another senior fellow named Hayden Rickley, who is a lawyer and health policy expert. He's doing really interesting research into vertical integration, especially in the Medicare Advantage space. Mm-hmm. We have a whole team of policy analysts, lawyers, some people with economics degrees.
Yes.
I think we interestingly have a lot of different backgrounds. Some people have poli-sci or economics background. My background is actually in journalism, and I started writing about health policy, and that's how I got into this work. So I think we have, a kind of diversity of perspectives that's helpful for the work that we do.
Okay, awesome. Well, again, I want to start out with the administration, but hopefully we can cover some ground because in a lot of ways, you guys have been a prominent voice and been willing to be aggressive and look for sort of comprehensive solutions where I would say a lot of others in the space can sometimes be, some of the solutions can feel stale or feel anemic. But what the work that you guys are doing and the policies you're proposing, I think are pretty neat. And so let's, are you comfortable kind of starting with the administration and the recent executive order?
Yeah, definitely.
Okay.
And that's really nice to hear that APCI, we have a vote of confidence there. But we're really focused on, we tackle these problems from a market perspective. And so we want to restructure markets to be competitive and fair. Yes. And so we don't want incremental changes that are going to allow the market to continue to function or, dysfunction and continue to hurt competitors and market participants. We want to restructure markets to be healthy and fair.
I love that point. And would you agree that when you look at the size of these PBMs and insurers and the vertical integration, that, in certain ways, incremental or modest changes aren't going to stop the behavior, right? They're so large and they can sway markets in such a way that you really do need oftentimes, meaningful material reform.
Absolutely. Yeah, I think it's too far gone at this point. And we've seen policymakers make incremental changes for a long time. And I don't think anyone feels like our drug pricing system or our healthcare system is operating well. So I think it's time to take those bigger swings. And I think we're seeing some of that momentum build, which is really exciting. The Arkansas law, I don't want to get off the topic of what the administration has done, but I think we are seeing some progress there, which is really exciting.
Yes, agreed. And so, talking about big swings, I think this is interesting because when Trump did his latest executive order, I would say focused largely on most favored nation pricing. sort of a fascinating document for a couple of reasons. One is certainly was a big swing, right? Like it wasn't like a modest attempt at bringing down drug prices. And I also think in certain ways, right, the intent was really good, which is lowering prescription drug prices for patients at the pharmacy counter. There was a lot of, I think folks sort of trying to figure out what the implications are, what it meant. And there still are some really smart people trying to do that. You all came out of the gate, I would say, maybe faster than anyone, certainly with like you had a really prominent op-ed that I thought was really well written and took a strong stance. And just if you'd be willing to just kind of share what that stance was on the executive order.
Yeah, definitely. So I agree. Like it's good that, and we've seen from the first Trump administration that he did take some big swings that targeted drug pricing. So like, that's good that we're in the world of making big changes. And, we absolutely agree with the administration that drugs are way too expensive in the US. This is a uniquely American problem and we need to fix it. In our op-ed, we really lay out our concerns, which is that kind of twofold. We think that the most favored nations policy is kind of based on the wrong premise. And even if it does take effect, which there's a lot of uncertainty around that, it won't actually address the root causes of why drugs are so expensive in the US. And so this idea that we need a most favored nations policy to force big pharma manufacturers to the executive order basically makes this argument that the reason drug prices in the US are so much higher here than in other countries is because American patients are subsidizing pharmaceutical manufacturers' global research and development budgets. And there's lots of good research by other organizations that shows that's actually not true. That pharmaceutical manufacturers often say that they have to charge these high prices to invest in research and development, and instead they're using them to jack up executive pay, to engage in stock buybacks, to do all of these really self-serving behaviors. And actually the reason, for our organization, why drug prices are so high in the US is because we have chosen in our policy decisions to subsidize corporate monopolies. So we allow big pharma companies to completely exploit the patent system to prevent generic and biosimilar, more affordable options from entering the market. That keeps prices, much higher than they need to be. And we also, unlike every other high-income country in the world, have allowed PBMs to play this enormous role in the setting of drug prices. And, in the op-ed, we say that high drug prices in the US is a homegrown problem. We can't make other countries solve this problem for us by imposing most favored nations policies. And there's a lot, I really want to stress that, that policy isn't going to fix the problem. And also it probably won't be implementable for a lot of reasons. But we need to solve the reasons at home for why we have much higher drug prices than in other countries.
Would it be fair to couch it, and obviously this is simplification, right? But it seems to me that your position is really that Americans aren't subsidizing lower costs overseas. They're subsidizing
higher
large
profits.
PBM profits and insurer profits. Is that fair to?
Exactly. Yeah, that's a much more succinct read. But yeah, we are subsidizing something. It's not lower prices abroad. It's higher profits from these big medicine corporations. Yeah,
and so I thought, to me, sort of interesting, right? Almost like a tale of two cities, because I agree. Mm-hmm. I think ultimately PBMs are the primary driver of high drug prices in the United States. I think obviously even his first executive order this term, he sort of honed in on pharmacy vendors to some degree, as well as in public-facing comments has made reference to PBMs. But what I will say, and I was encouraged by this executive order from the perspective of at a time where sometimes a lot of the congressional solutions that have consolidated the most support are really sort of small step. You've got a president here who is swinging big, and looking to use, when you read through that executive order, it's fascinating because really it calls on almost like so many significant agency heads, right? Or agencies. It calls on HHS. It calls on the FDA. It calls on the FTC and the DOJ. It calls on the Secretary of Commerce, all of them to sort of leverage the goal of lower drug prices. Again, this is looking from a lens of most favored nations. You and I have talked about this, I think, in the past, but in his first term, he had another executive order that looked to lower drug prices. And that was dealing with the safe harbor for pharmaceutical rebates to PBMs.
Yeah,
and that's on that action.
Yeah, well, we're a huge fan of that, and we would really like to see the administration revive rulemaking around that. That rule was finalized at the very end of the first Trump administration, and then through a series of unrelated congressional budget riders has basically been delayed from being implemented until 2032. But
ultimately, the Inflation Reduction Act, right, was bumped it to around 2032.
Yeah, I think there were a couple other bills, but that was the big one.
That was the big one.
But that's a great example of something that would really change the business model of PBMs. It wouldn't allow them to use these kickbacks that would otherwise be a felony offense and are for many other people and businesses in the healthcare industry. They have this exemption that's allowing their entire business model to work on rebates and kickbacks and other discounts that really distort incentives.
Absolutely. And one of the things that to me is always interesting is that sort of the implementation got delayed based on a CBO score. And the CBO score essentially said, hey, this is going to cost the federal government money. It based it on really a projection seemingly pulled out of air. I think it said, based on stakeholder input, that 15% less rebates would be negotiated. But it was a footnote in the CBO score without a number. But if you read the footnote and you trace it to the Medicare actuary report, I think it was $93 billion in savings at the drug counter for patients by implementing that. Right. Ultimately, what we're talking about here is PBMs are demanding negotiation, whatever the word is, for formulary placement. They are demanding from drug manufacturers massive rebates, but they're basically basing beneficiary cost sharing, out-of-pocket costs, based on gross prices and not net prices. And that essentially what Trump sought to do in that first term was return those savings to the patients themselves instead of allowing the PBMs and the insurers to keep it. Would you all like to see Trump revisit that and Congress?
Yeah, no, we definitely would. And, we have a lot of the same concerns with the CBO scoring, just these flawed assumptions that have really stymied what we think will be a very effective policy intervention. We would like to see HHS make that change. We would also like to see Congress pass legislation to codify the repeal of the safe harbor. And you don't have to take my word for why we think it will be effective. There's lots of good reporting from states that have carved PBMs out of their state Medicaid managed care programs, and you see how much money they're saving by getting rid of PBMs in this rebate-based system. I'm from Cleveland, so I'll brag on Ohio, which just released a report that shows that the state's Medicaid program saved more than $330 million in just 2 years by cutting out the big three PBMs from its program. And they were able to reinvest more than half of that into, really significantly increasing pharmacy reimbursement rates. So this idea that you can't increase pharmacy reimbursement and save money, PBMs are taking so much money out of the system. There's a lot of room to improve pharmacy reimbursement, get rid of PBM grift, save patients money, save taxpayers money. We are seeing this impact us at the state level.
Yeah. And I don't think anybody said it better than that. And love that you point out Ohio. Particularly with Medicaid, Ohio has led the way, and they're doing some interesting things now in their legislative session. But obviously, good friend of and fan of Antonio Chacha and Three Axis and the work that they have done in really sort of the originals in exposing PBM spread pricing games and the money that they can suck out of the system, when you have these governmental payers. And of course, we know that there's similar games in the commercial market as well. Okay, so fan of Trump's initial first term efforts with regard to repealing the rebate safe harbor as to drug manufacturer payments at PBMs. You guys also weighed in a really smart way recently, I think, in connection with, and I thought this was particularly interesting. The DOJ has formed a task force. I think it's an anti-competitive regulation task force, and they were submitting public comments. And I'll tell you, one of the things that I was thrilled to see out of the gate was that they referenced regulatory capture, right? Because it's something that I don't think gets talked about enough. The control that large companies, particularly in the healthcare space, insurers and PBMs can have over parts of agencies that are really supposed to be overseeing them in many ways, and yet they're able to shape policies, rules, regulations in a manner that so often really opens the door for some of the bad practices or anti-competitive practices that they engage in. But you all submitted really, really smart comments on it. I'd like to talk a little bit about it because you all, again, you're not, I mean, I know you in particular are focused on healthcare, but American Economic Liberties itself is not just focused on healthcare, right? And there's so many areas that could focus on, but a portion of your comments did focus on in healthcare in particular with regard to pharmacy benefit managers. So just love to hear your thoughts a little bit about how that came together and what you submitted.
Yeah, definitely. So like you said, the Justice Department has this new anti-competitive regulations task force, and we put together healthcare specific comments. And, we don't believe that deregulation alone is a sufficient solution to this problem of, increasingly concentrated economic power. And, in a lot of cases, increased regulation of healthcare markets is necessary to protect patients and payers. But given this request for information, this opportunity to comment, we really wanted to point out policies that could either be repealed, like the safe harbor for PBMs, or revised to get rid of some of that. We often refer to it at AELP as like private regulation by private corporations.
Yes.
They're acting as kind of their own government, and it's hurting the rest of us. So we wanted to identify some of those policies that we see as really harmful and that would be, ripe for deregulation, and then also emphasize that deregulation must happen in the context of strengthening pro-competitive regulations. So we really see that as increasing enforcement of antitrust laws and all of the important work that the federal government does to, it's not just getting rid of anti-competitive regulations, it's also reinforcing pro-competitive regulations, of which there are many.
Yeah, I thought that was really well done. I also liked that you guys referenced the non-interference clause with regard to Medicare. I thought that was a really good, smart take and smart call out.
I think that's, a good example of something that really prohibits HHS from fully addressing abusive PBM practices like below-cost reimbursements. And we want to empower federal agencies to do their job to regulate these markets.
Yeah, absolutely. And again, so the PBMs and insurers have been really successful in pushing back against HHS CMS and saying, basically getting CMS to agree with their interpretation of the non-interference clause so that they in no way can, essentially step between pharmacies and PBMs and rein in anti-competitive behavior. CMS's initial interpretation, right, really wasn't that. And so I think it's another example of maybe not regulatory capture, but the PBMs and prescription drug plans and insurers really getting CMS to agree with their view and legal interpretation of the non-interference clause, which is really draconian for providers, for sure. A little bit of a digression, but one of the things that American Pharmacy Cooperative submitted in terms of our comments was sort of the angle of how CMS regs can oftentimes embolden some of these problematic practices. And we talked about the safe harbor. One of the things that I think doesn't get talked about enough is that federal law reads to me really unambiguously. It says that beneficiaries in Part D should get the benefit of negotiated prices in federal law. And in federal law, it includes within the definition rebates, right? And so essentially PBMs are able to deny beneficiaries rebates in Part D on a massive scale. In 2021, we know through a MedPAC report that they denied beneficiaries $50 billion in discounts, right? So seniors overpaid $50 billion in 2021 for prescription drugs. And that they're able to do that because CMS's definition of negotiated price doesn't include drug manufacturer discounts. So they just sort of exclude, and based on stakeholder input, a category where there's $50 billion in discounts that aren't being passed back to beneficiaries. And so, there's so many different ways you can tackle this, right? Like, obviously, there's potential for law change. There's the potential to do it via the safe harbor, whether it's law or regulatory, which Trump initially did following his executive order in his first term. But it could also be as simple as changing the definition of negotiated price, which CMS absolutely has the power to do. They did it a few years ago with regard to pharmacy discounts. So, but I was a big fan of your comments. And again, I thought it was just another example of American Economic Liberties weighing in a really smart way and an aggressive way, but with like well-founded solutions. So I thought really very well done.
Well, the feeling is mutual. I really liked how in APCI's comment, you focused on, where there's daylight between the law and the regulations. And, getting rid of anti-competitive regulations might mean making sure that the law is being enforced as it was written.
Yeah, with its spirit, because saying, right, we've got any willing provider, yet CMS has paved the way for, preferred networks, which is, again, another tool that can be used to steer in a multiple of ways.
Yeah. And something that, kind of gives me hope and fortitude doing this work is something that my colleague Hayden McClay often says, which is like public policy, like the ones that you pointed out, the CMS regulations, help get us into this mess, but it's also the solution.
Yes,
smart policy making can get us out of this mess and really improve a situation. And I feel like it's exciting to like read people's comments and see where there are new ideas for improvement.
Right, absolutely. And another thing, this is a little bit of digression, but you guys do a lot of work in terms of trying to bring in stakeholders and bounce around ideas and come up with policy solutions. And I don't know that happens enough, right? So often we're all in our own bubble or our own vacuum. Lord knows I am when it comes to, a lot of this stuff, right? It's easy to put your head down and just be sort of operating from our own perspectives. And I think you guys are also great in terms of building coalitions to advance these policies.
Yeah, no, that's like one of my favorite parts of the job is getting to talk to people and also learning from experts. So like independent pharmacists have been such leaders in this space and have really, the PBM reforms that we're seeing today, I know have been the product of years, decades even of work. And I think a lot of other healthcare professionals, we're seeing physicians unionized, we're seeing residents unionized, we're seeing other subsets of healthcare professionals really want to, I think, are feeling a lot of the angst and despair about where their industry is headed and have a lot to learn from independent pharmacist organizations that have been leaders in this space. So, I often hear my colleagues talk about AALP as, kind of leveraging all that expertise and helping people connect who can learn from each other. And we can learn from experts in this space because, we aren't focused on any one thing. We work in a lot of different areas. So we really rely on the organizations that are the subject matter experts to guide the work that we do.
Yeah, well, it's very cool. And again, you guys have built some really strong coalitions, and that's a neat thing to see. You guys have also engaged, I think, in a really high-end way with the FTC in connection with the 6B study. I don't want to, because I know we got to get to the congressional stuff too, but just real quick, your thoughts or a little summary of the work you all have done with the FTC in connection with the 6B study, because you guys have done some great stuff there.
Yeah, The FTC has done really great work in this space, and this kind of predates my joining AELP, but I know the FTC has a huge role to play in obviously ensuring markets are competitive. And I think with PBMs, we have this ongoing study that has already produced 2 really substantial reports that have given us so much more information about how PBMs operate. I think it's galvanized so much outrage, rightly so, on the Hill and in the public. We see such great reporting in the New York Times and other outlets on this. We now have a lawsuit against the big 3 for jacking up the price of insulin, which is, obviously has very deadly consequences. We would really like, more recently, what we've been advocating for is that the FTC finish its study, really aggressively litigate its case against the big 3. And we really see this study and the lawsuit as templates for additional future investigations into drug pricing. So, we really were big supporters of the FTC's investigation last year into group purchasing organizations and wholesale drug distributors and their role in driving up prices and also contributing to really constant, dangerous drug shortages. We would love to see them take a similar approach to, publishing these really in-depth studies and also suing the big 3 and the GPO and wholesaler markets, similar to how they've taken on the PBMs.
Yeah, absolutely. And, I thought one of the interesting things, in connection with like the DOJ suit on the insulin was it was based on Section 5, the FTC Act, unfair trade practices, for which there's not a private right of action under that. But look, like insulin isn't the only place that's going on, right? There's so many different areas that, prescription drugs, brand name drugs, where we see those same rebate games and brand mandates when there's lower cost generics and, just so many of those practices. So, okay, I do want to switch here and talk a little bit about congressional action, because it's been, I think, just fascinating at the federal level, we'll say, and love, again, we could have you on again to talk about just the state stuff. I mean, there's been so much activity at the state level, but for years and years and years, right, in pharmacy, there really hasn't been, I would say, super aggressive PBM reform, right? Like you've seen at the state level, certainly, where there's just, you've seen Arkansas introduce first in the nation bills, and West Virginia and Kentucky, Georgia, Tennessee, right? There's been a whole, and I don't want to leave out the North, right? New York has done some really big stuff. So you've just seen, and Oklahoma never gets enough credit, I don't think. Oklahoma always passes some really big, interesting PBM stuff. But so we really haven't seen the federal initiatives really match that pace. And oftentimes, some of the federal initiatives are following what states have done several years ago in many ways, right? So there has been some momentum, regarding like a potential bipartisan package, that seemingly both chambers have agreed on. And one of the things that's in there that we like a lot is that, it's certainly the Medicaid managed care reform, and basically taking away the ability of PBMs to set, drug prices and Medicaid managed care, prohibit spread pricing, pay based on NADAC plus a fair dispensing fee. But there's some, some transparency provisions in there as well. But I would say other than that, there's not been a lot of really aggressive solutions until the last few years. And you guys, I think, have really jumped out and supported some of this legislation, even when sometimes others have been hesitant to, because, maybe they feel, hey, it's too aggressive, or, hey, we have to move at sort of a slower pace. But one of the big things was the Patient Before Monopolies Act, right? And you guys were really, I think loud, enthusiastic proponents of that concept, and continue to be. For listeners who may not know, can you talk a little bit about what that does and why you all got behind it the way that you did?
Yeah, no, I would love to talk about the Patients Before Monopolies Act. So this is bipartisan legislation introduced last session by Senators Elizabeth Warren and Josh Hawley in the Senate, and Representative Jake Auchincloss and Diana Harshbarger in the House. Bipartisan, it's bicameral. And, a lot of times legislation is really confusing. This, I think, is really easy to explain. This bill would require insurance companies and PBMs that own pharmacies to divest their pharmacy businesses within 3 years. We really see this as critical to this fight to break up big medicine. All three of the largest PBMs are owned by the largest insurers. They also own pharmacies, mail order pharmacies, specialty pharmacies. And that vertically integrated structure creates all sorts of perverse incentives to drive prices up, to really, really gouge independent pharmacies, reimburse them much less than their cost. It's driving independent pharmacies out of business. They're overpaying their own pharmacy subsidiaries, crazy markups. The second SEC report showed that the markups could be as high as 7,733% on average for certain drugs.
That's
and I
crazy.
think that number is like bananas high, and everyone should know it. But this bill would say, if you want to be a PBM, you can't also own pharmacies. There's so many conflicts of interest inherent to their common ownership, and it shouldn't be allowed. And I think when it was introduced last session, it was seen as, maybe not feasible in the short term. And incredibly, Arkansas just passed its own equivalent version of the bill at the state level. And as part of that effort, the Arkansas Attorney General and I think 38 other state and territory AGs wrote a letter to Congress saying, you guys should do the same thing. You should pass legislation like this. So I think we're seeing really widespread bipartisan support for this type of reform. And I know we're here to talk about PBM reform, but at AELP, we're really excited about what this bill in particular means for additional structural separation reforms in healthcare. Because it's obviously PBMs owning pharmacies is a huge problem, but so is insurance companies owning physician practices and wholesale drug distributors owning oncology clinics. Those are also big problems that we want to see addressed. And this is really, I think, straightforward legislation that would help.
It's simple. And I'll tell you something that excited me is, again, that you're seeing just aggressive federal reform, because historically we haven't seen that in the PBM space, right? And what I don't hold my feet to the fire on this, but almost always federal bills are sort of following something that's happened in states. And here, this is a federal policy that was presented, and what happens? Arkansas, by God, picks it up and runs with it. And, there are some folks who thought, hey, maybe this is just a messaging bill. Maybe this is just really sending a statement. And I can't speak for them. I don't think the bill sponsors looked at it that way at all, right? And I'll tell you what, it wasn't a messaging bill in Arkansas because it's the law. And, Governor Sarah Huckabee Sanders has just been a steadfast champion of this. And not only did she sign it into law, right, but she has been a vocal champion on ending anti-competitive PBM practices. And so it's just so exciting to see a state sort of, again, there was a federal bill, and then we see states sort of looking at that policy and it shaping the direction of where their policy goes. And if they did, not only did they introduce it, they passed it, and it's, the law of the land in Arkansas.
Yeah, absolutely. And I think you're so right about this bill sponsors in Congress. I think they're really committed to this work. Jake Auchincloss and Diana Harshbarger are constantly talking about PBMs. I think Warren and Hawley have done really interesting work together on addressing corporate power and trying to rein that in. And I also, when we were talking about Congress, it seems starting to really consider these more structural reforms. I sit and listen to all of the hearings that they have on PBMs, and there's been a lot recently.
Yes.
And increasingly, you hear members on both sides of the aisle basically express frustration that they're in yet another hearing about PBM reform, and they have yet to pass. I think that kind of frustration might be a good motivator for getting some of these more significant reforms over the finish line.
Absolutely. And it's also nice to see that you've got sort of new champions and other champions emerging. And a lot of these folks, I don't want to say new, because a lot of these folks have been doing, good work for a long time on the issue. But as recently as 8 years ago, it seemed in a way, right, that obviously Representative Buddy Carter, who's a pharmacist, was ringing the bell, maybe the loudest. You had Doug Collins, Representative Doug Collins, who was just one of the original champions for PBM reform at the federal level. But I mean, we're at a point now where there are a lot of folks who are fighting really, really hard to rein in anti-competitive PBM practices and also to bring just fairness to the market. And in the House and the Senate. And so it's really neat. I mean, there were I don't even know how many bills by the end of 2024. How many bills do you think were touching PBMs and drug pricing in Congress? I don't mean to put you on the spot, but over 60, 70? I mean, I'll bet you there were.
Like scored. And I think you see a really wide range of kind of aggressiveness in those bills. Some are very incremental and then others are taking big swings, but
big swings. Pharmacists Fight Back Act. You guys were, again, there were some folks out there who were hesitant to get behind that out of the gate. It ended up getting 56 co-sponsors, and you all did a lot of work on it. Like that was one that you all liked. And again, we've talked about sort of smaller change versus sweeping change. And that bill, did look to take away the ability for PBMs to set drug prices, take away their ability to steer, take away their ability to restrict access via preferred networks. But talk to us a little bit about why you got behind that bill as strongly as you did.
Yeah, I mean, again, we want to see these markets restructured. And I think the Pharmacists Fight Back Act, it really will restore the financial viability of the independent pharmacy model by setting these baseline reimbursement rates in federal healthcare programs, which of course are huge populations. And I think when, people who maybe aren't in the pharmacy world hear that a PBM can reimburse a pharmacy below cost, like, of course, that doesn't make any business sense. That's why we have pharmacy deserts. That's why patients are struggling to get the type of in-person care that they want and deserve and expect. So I think this bill, really addresses like a clear problem, which is PBMs using their market power to not, under reimburse their competitors who are independent pharmacies, and it would mandate that they pay them a fair, competitive price. Again, like simple. And I think we've seen the viability of this type of intervention in states that have carved out pharmacy benefits from their Medicaid managed care program. Like, we know that this is effective. We know that it works. We know that it saves money. We know that it helps independent pharmacies stay in business. So it really is, a tested solution.
So to that point, I know we're running out of time, but you've touched on this a few times, right? Like we know these things. We've seen massive markups, right? The FTC's uncovered them. We worked on a white paper looking at federal employee health plan, and we found a multiple sclerosis drug marked up 47,000%, right? Like just craziness. Yeah. But for years and years, PBMs and insurers have literally sold to clients, right, employer groups, but also to governmental entities and really legislators, sort of this narrative of, hey, steering saves money and our pharmacies are lower cost. And it seems like under every rock you look, the evidence runs counter to that. And then to your point, I think, as you see more and more states implement things and you see more and more evidence of savings doing that, right? It's like that narrative doesn't fly anymore, right? The vertical integration saves money, and our vertically integrated pharmacies we treat in a certain way. Like it doesn't seem to fly anymore. Would like your opinion on this, and this is a little off the cuff, not looking for a comprehensive answer, but despite all of the evidence, right? The evidence of state reforms lowering cost, the evidence of like massive markups that 3-Axis has uncovered, or the FTC has uncovered, or things we've seen in states, employers still very much sort of by these long-time presumptions that PBMs have asserted, and also some agency heads at the state and federal level, and I would even argue some of the Congressional Budget Office folks, right, accept these presumptions that sort of the status quo is working. And I get change is hard, and sometimes that's a compelling reason enough. But do you have any thoughts on how to sort of open the eyes of folks in the commercial market or some of these agencies at the state or federal level? Any thoughts? Because to your point, I mean, like you're saying it like it's a foregone conclusion. These things save money and these PBM practices raise costs. But there's a lot of folks who still buy the opposite presumption.
Yeah, that's such a good question, and something we've been thinking about a lot. We were talking earlier about coalition building, and we think it's really important that coalition includes employers,
Yes.
business owners, state Medicaid programs, state employee benefit plans. I think business owners and employers, their voice has a lot of weight with elected officials, and in talking to businesses, I do think that there is a lot of frustration with the current employee health plan environment. Maybe they don't have the wherewithal to try to change it. Maybe they don't feel like they are expert enough in the healthcare industry to pursue it further. But I don't think, and there's lots of polling and studies that show that employers are not happy with, their health plan costs rising 10% year over year, largely driven by prescription drug costs that are jacked up by PBMs. And I think, bringing them on board and building on, building their awareness of the problem. I think independent pharmacists and APCI and other organizations like yours have done such a public service by educating the public about what PBMs are and why they're problematic and how they hurt not just pharmacies, but also patients, leveraging that greater public awareness to bring employers and business people into the fold, bring state policymakers into the fold, because, I don't have evidence to point to, right here in this moment, but I don't think that they're satisfied with the service that they're getting.
Absolutely. Love it. Yeah. So, and I know we're about out of time here, so have to wrap up. But when we talk about sort of magnifying messaging and magnifying voices, and I sort of started this with talking about how we tend to speak in echo chambers. I think your voice, and as well as American Economic Liberties voice, right? Like you guys are really, really smart voices on this issue, and would certainly encourage all the pharmacists and healthcare policy people that are listening to this to follow your work and what you are doing via your website. How can pharmacists and healthcare policy people at the state and federal level that listen to this podcast, how can they follow the work that you're doing and American Economic Liberties is doing?
Yes, well, an easy way to do that is to go to our Break Up Big Medicine website, which is breakupbigmedicine.com. And that's really, a home for our healthcare policy work. You can sign up there to get regular updates on policy developments. And, we are serious when we say that we want to hear from people who are signed up there. If you're a policymaker, if you're a pharmacist, if you are just obsessed with how our healthcare system is broken and have ideas, please reach out. I would love to hear more from you. And you can get all of that at breakupbigmedicine.com.
Awesome. And then do you have an X account or any other social media accounts where folks can follow you?
Yes, we do. We are on X. Let me make sure I'm giving y'all the right handle. It is at Econ Liberties. You can just search American Economic Liberties on X. Our Economic Liberties website is economicliberties.us. And yeah, we would love for you to learn more about us and to reach out.
That's great. And I would encourage everybody to follow you. Again, in my opinion, you all are doing some of the smartest, most aggressive work that's being done. And so thank you so much for joining today. Thank you for all the work that you're doing. in general, right? But particularly with regard to PBM reform and PBM anti-competitive practices, as well as also a voice for treating independent pharmacies fairly in this sort of crazy drug pricing system. So I can't thank you enough. I want to have you back on so we can talk more about state stuff at some point soon. But just thank you so much for being here today.
Oh, thank you so much, Greg, and congratulations on taking over the podcast.
Thank you.
Hey, we thank you, listeners, for listening to the PBM Reform Podcast, brought to you by APCI. You can learn more about APCI by going to apcinet.com. Once again, that's apcinet.com. Thank you, Greg. It's been great to talk with you and listen to you and Emma discuss the importance of PBM reform and how we can all work together to make a better system that's in our midst today. It has to get better. We all want it to definitely get better. And I'm a half glass full kind of guy. I think it is getting better. And we can't wait to the next episode of the PBM Reform Podcast, and we'll talk with you soon.